Reflecting the lifestyle and characteristics of this beachside district, the master plan is highly responsive to the natural landscape, ideally locating the main hospital building in a parkland setting, which will become a vital urban campus. Featuring expanses of green spaces, specially allocated for patients, staff and community use, the building's orientation captures sweeping forest and ocean views. The on-grade car park sits to the east of the site, while the mental health unit is positioned to the south, with a direct link to main hospital. As facility purpose-designed for the northern beaches, the NBH will encourage community use by offering shared amenities, including bike paths, shops, retail, cafes and outdoor eating areas. Arriving along French's Forest Road by public transport or car, the hospital is clearly identified from a distance by the striking timber feature window frames that define the inpatient units. If choosing to park, easy access is provided from the car park situated adjacent to the building at the northern end. A canopy conveniently links the car park to the main entrance, clearly denoting the path. The emergency department entrance is distinct and immediately visible from French's Forest Road, with segregated access for both public and emergency vehicles. For patients requiring drop-off at the main entry, a tree-lined boulevard forms a green spine through the site, a wayfinding device leading to the front door of the hospital, creating a pleasant landscaped entry experience. Alighting at the drop-off zone, the entry door is unobstructed and clearly in view, aiding orientation in what is often a stressful time for carers and patients. Soft landscaping and outdoor eating areas further contribute to an attractive and calm arrival environment. Upon entering, a light-filled atrium forms the heart of the hospital building, from which the main circulation paths lead. Wayfinding is simple and legible, supported by an information desk with staff on hand, ready to help. Cafes and comfortable waiting areas create a relaxed, non-clinical ambience. This hospital features state-of-the-art operating theatres, dedicated teaching and education facilities, conference rooms and 439 beds, catering for both public and private patients. High visitation departments, emergency, medical imaging, the ambulatory care centre and pharmacy are positioned on the ground floor, accessed from the main circulation street. For patient convenience, the dialysis centre and medical day unit, which incorporates chemotherapy, are also located on the ground floor, either accessed from the front entry or with a discreet patient entry and drop-off from the south. Views to the hospital garden from these departments offers enjoyment and a distraction for patients in all-day treatment. Level 1 accommodates the interventional suite, day of surgery centre and ICU, providing a hot floor of critical clinical adjacencies. Level 2 provides birthing suites, maternity unit, the special care nursery and the paediatric unit. Paediatrics also features rooftop gardens. Inpatients units are located on levels 3, 4 and 5, with public wards to the south and private wards to the north. All wards enjoy expansive views with a combination of ocean and city outlooks. Consulting suites are located on levels 5 and 6 on the northern side of the building, also experiencing impressive views of the national park and sea. The emergency department focuses on early assessment and treatment to ensure the patient is streamed into the most appropriate environment for immediate and subsequent ongoing care. The Day of Surgery Centre takes a single point of entry approach for the admission of surgical and procedural patients for an interventional service, whether for a day procedure or longer stay, creating an efficient and streamlined service. The operating theatres feature state-of-the-art technology in digital theatres, offering the most advanced care and education and training opportunities available. The inpatient units enhance the patient-centred care philosophy of the hospital, ensuring the service to all patients and visitors is relevant to their needs. A welcoming and safe environment has been created that is conducive to healing and improving well-being, while also recognising the needs of staff and doctors and encouraging efficient work practices.